What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watch the video, maybe even like and subscribe. I appreciate you. And welcome back. So today I want to talk to our community about something that I was thinking about today. And that is, do not suffer in silence. Yes, do not suffer in silence. Now, the reason that I say that to you is because there's a lot of stuff that goes on with us as we go through this prostate cancer journey that we don't want to say anything about. We don't want to talk about it. It's not even a discussion point because you can't even get to terms with it on your own, much less wanting to talk about it. But we have to drop the stigma that's attached to that. We got to be able to have these conversations. You see, there's no reason to suffer in silence. Let's say, for instance, you're having erectile dysfunction. You don't want to tell anybody that you're having erectile dysfunction. Your relationship is suffering on the back end. And instead of going to get some help or asking for some help, you're suffering through this problem. And it may be possible that somebody you know, your doctor, will quickly have an answer for whatever is going on with you. And, if possible, help you along and fix whatever issue you're facing. But we suffer in silence because we don't want to talk about that. Oftentimes you'll have a friend of yours that knows how to do something. You never even asked them if they could. They've never volunteered that information. And then you finish whatever it is you were doing, you're building a shed, and they're like, hey man, I build sheds in my spare time. You should have said something. That's exactly what I'm saying in regards to your medical care. A lot of times you don't even want to go to the doctor. And after you have had prostate cancer, and you've had radiation, you had the hormone therapy, you've had whatever it is, your radical prostatectomy, not going to the doctor is no longer an option, gentlemen. It's just no longer an option. Because the point I'm trying to make to you is, you are, since you've had prostate cancer, the likelihood of you getting another type of cancer goes up tremendously. So you got to go get checked. I am a huge proponent of making sure that you have a great primary care physician that has a place attached to their office where you can get your blood drawn on site. I will talk about that all day, every day, because it saved my life. And for my friends that I sent to my primary care physician, saved their lives too. One was pre-diabetic, had no idea. My vitamin D level was so low that I took 50,000 IU twice a week for a year and a half before it got back to normal. All because of my blood work. And I say that to you now. Your urologist is going to be taking your PSA, your blood to check your PSA and give you the cup, see if you have a urinary issue, and you're going home. But there are places in there where if you don't want to go to the doctor and you just want to suffer in silence, that you're going to go through what you believe is going on with your No, it might be something totally different. Because your body's been over here fighting. It's been fighting that battle over there. And because of that, you might have got an infection or some swelling or something else that wasn't going on in your body. We're talking about them fighting your body and everything. Your immune system is fighting cancer, gentlemen. So, keep that in mind. Because you're suffering in silence with just missing out on valuable information. Hey, how did you and your wife get over dealing with this prostate cancer issue? Hey, what did you do when sleeping with your spouse in the same bed and you kept wetting yourself? Hey, what did you do on this side when you had to go to work and you were at a job where you couldn't get up and go back and forth to the restroom? the answer to those questions are out there. There are guys who have shared your circumstance, and there are also those who have overcome it. And they have figured out a way to overcome it just based on ingenuity that we normally have. We have a problem, we figure out how to fix it. But if we do not share that on a larger scale, then what are we really doing? And if you do not feel comfortable asking that question, then what are you really doing? Because your circumstance is not going to change. And what I mean is it may get better, but it's not going to change. You are in this prostate cancer fight no matter where you are in this journey. Whether you are just starting and you've been diagnosed or you've had it for years and years and years. We're in the same journey. The thing is, the best way to find out what to expect about prostate cancer is to ask a prostate cancer survivor. Because everybody else gets to treat you and go home. But every single day, that prostate cancer survivor takes those outcomes home with them. And whether they are present in every single day or whether they come on at the most inopportune times. Same thing. So, get over yourself. Because I tell you, I could say that to you because I would never do this in any other circumstance. But I will tell you what, I'm trying everything I possibly can to figure out the best ways to go about this journey. And I'm going to share every single one. And that is not my personality at all. So I'm asking you, can you, would you kind of suck it up a little bit and start to feel as though you can share some of those great ideas that you've already come up with? Or ask and get some of the great ideas others have had. I hope this finds you well. Peace and blessings, fellas.